1.5 million Americans have Parkinson's disease, with an estimated 60,000 new cases diagnosed each year. We spoke with Dr. Janet Chance of Hoag Memorial Hospital Presbyterian in Newport Beach about the latest information on diagnosis and treatment.
Movement disorders are brain diseases that have to do with how you move. And they can be hyperkinetic, in other words, movement disorders where there's overactivity, and hypokinetic movement disorders where there is less motor activity. Okay? And of the hypokinetic movement disorders, Parkinson's would be the absolute classic example. And it's really the commonest of all the movement disorders that we see, and certainly makes up the vast majority of my practice. Parkinson's is a steadily progressive disease. It gets worse. And the best that we can do is try to keep pace with the symptoms with medication or surgery. But the major symptoms are the tremor, the stiffness, the slowness of movement, and the difficulty with balance. Many patients will notice that their speech has become softer and it's harder to hear, harder to understand. They might notice that they're having a little difficulty swallowing, tendency to choke on liquids. Now, when you diagnose Parkinson's, it is still predominantly a clinical diagnosis. The patient tells you what's wrong with them. There really isn't any specific test that we can do. Now, all we do is treat the symptoms. We have no way of effectively treating the disease process itself. So we have to be fairly careful with how we use the medications. So oftentimes patients will come in and they're young-ish, they're healthy, they're not very troubled by their symptoms, they just want to know what's wrong. And my first question is, how much is this bothering you? And if it's not bothering them a lot and they're not really limited, then I'll say, come back and see me in 3-4 months and we'll see how you're doing. And we basically let them dictate the time of onset of treatment. Treatment basically ranges from medication to physical therapy, occupational therapy, speech therapy, and when all else fails, surgery is a very good option. That's a more recent option. We don't do surgery until we've run out of every medication option. So it's basically if a patient who has had a really good response to the routine medications has gotten to a point where the long-term side effects with involuntary movements fluctuating between being overdosed and underdosed so that you have very little normal functional time. When you get to that point and you've manipulated the meds as much as you can, that's when you say, it's time to think about surgery. And the results really can be phenomenal. But they are not necessarily phenomenal for every patient, and you really have to be sure of what you're doing before the patient has surgery. There is a selection process. We've had a program here at Hoag for quite some time now. It's been involved with the National Parkinson's Foundation. What we do is we see the patients, then they can be referred to physical therapy, to occupational therapy, to speech therapy. We have a very good balance and gait program now, which is tremendously effective for these patients. We give them a flexibility exercise program to do. Then the surgical approach, and the main thing that we do now is DBS, and we do that in-house. We can do the programming of the device in-house, and it really has enhanced what we can do. So we really have a kind of an all-round program for patients, and it's been pretty successful.
Join us next time when the American Health Journal brings you more in our ongoing series of reports for your better health. If you have questions about today's topics or for the doctors you've seen on today's show, you can contact us at 1-800-303-3200 or log on to thedoctorshow.com. Until next time, I'm your host, Roger Cooper, for the American Health Journal.